Hello, I'm Dr. Robert Jones, Medical Director for the Student Health Center at UNC Charlotte. COVID-19 has impacted all of our daily lives, and things will be different this fall when you return to campus. While many young people have limited symptoms and fully recovered from COVID-19, some do have more significant problems and require hospitalization. And even if you personally don't get sick, you could put other more vulnerable friends and loved ones at risk. The best tools we have to slow the spread of COVID-19 are physical distancing, face coverings, and hand hygiene. This is because COVID-19 easily spreads through air and on surfaces. Keeping a distance of 6 feet from each other and wearing a face covering limits your exposure. The university environment contains many shared spaces such as dining halls, classrooms, and dorms. These spaces pose a challenge to physical distancing. The university is doing everything it can to make these spaces safer. When in public, wearing a facial covering can greatly reduce your chances of spreading the virus if you are infected and don't know it. When wearing a face covering, you want to make sure that your mouth and nose are covered. If a face covering causes your glasses to fog up, pinch the top of the nose piece across the bridge of your nose. You also want to make sure that your hands are cleaned before touching your face and before and after placing or removing your face covering. You can use soap and water or hand sanitizer. When you do take off your covering, remove it by the ear loops or overhead straps and consider keeping it in a Ziploc bag around your neck or looped on one ear. If you are wearing a disposable face covering, make sure you dispose of it properly and clean your hands afterwards. This fall will be very different, but physical distancing does not mean social isolation. Let's all work together to keep Niner Nation safe.